The theme of the first week of National Safety Month 2025 is continuous improvement. The question is, has psychological health and safety in the United States improved, especially in the 3 years since this podcast has been on the air? We'll have that conversation with a returning guest that's in the business of better workplace mental health up next on this episode of the Psych Health and Safety USA podcast. From Flourish DX, this is the Psych Health and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each week, we look at psychological safety from an occupational health and safety perspective. Let's talk psychological health and safety. Welcome to this week's Psych Health and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. So in June 2024, I had the opportunity to speak at PHSCON 2024 in Sydney, Australia, and share my perspective on psychological health and safety in the United States from my professional experience as an occupational health and safety expert. This year, the perspective on psychological health and safety will be presented by a clinical psychologist. As this episode debuts, we'll be beginning National Safety Month, and I thought it would be a great opportunity to share and to explore a little bit about psychological health and safety throughout the month. So in this episode, we're going to talk about the perspective of someone who's actually in the business of addressing workplace mental health, has that background, and is actually going to be sharing with the folks over in Australia what's going on here in the U.S. As we talked a little bit before we got on, things may not be as perfect as many of us would like them to be, but I do believe they've gotten better. So to have this conversation, I'd like to welcome back a returning guest from episode 41, which was released almost exactly 2 years ago as this episode is being recorded. So let's reintroduce, for those who may have forgotten, have an introduction of my guest by my guest with this question: who is Dr. Joe Grasso?
I love the existential nature of this question. I am, to your point, a clinical psychologist by training, which I know makes me a little unusual in this space, but I think when you understand the journey to how I got here, it all makes sense. My roots in systems thinking, which I think really underpins my interest in psychological health and safety, took hold during my postdoctoral fellowship at the University of California, San Francisco, and the San Francisco VA Medical Center. There, I focused on implementation science and quality improvement. So what that means is, while I do really enjoy seeing patients one-on-one, my interest for a long time has actually been on systems of care and models of care. And what does it look like to design mental health support in ways that have macro level impact? And how do we optimize those systems to work in the real world? Because there's a lot of research on what can work to increase access to care or make care more effective. But when the rubber meets the road and that needs to be implemented in a real life scenario, it's a lot of adaptation that has to happen. And that's always interested me. So I got my start at the VA and UCSF, studying that work, doing that work. And through that work, I really got obsessed with this question of how do we improve mental health at scale, not just for individuals, but across organizations and populations. And so I went on to do that macro level work at the VA, integrating mental health into primary care across the VA system. And that work was really rewarding. But I started to get interested in how we could do this beyond government healthcare, and that led me to Lyra. So Lyra is a mental health benefits company. We provide holistic workforce mental health solutions to employers, And I started at Lyra about 7 years ago, managing clinical quality for our provider network. But I kept getting pulled toward doing this side work because we were an early stage company at that point and everyone had side work. And my side work was workplace focused education, specifically creating and delivering mental health workshops. And I really enjoyed it. I had never worked with employers before. I got to learn more about the opportunities in the workplace to promote mental health as a priority that had never been on my radar before. And also learn that there are folks doing this work to promote mental health in the workplace that were really short staffed and needed some extra help. And so, in doing these workshops and providing consultation to employers on mental health learning and development, I saw a real opportunity to expand that support and organically grew what is now a function at Lyra that we call workforce transformation. And it focuses on helping employers create conditions within the workplace. So, well beyond care benefits, what do we do within the workplace to both promote mental health and protect against harm? And there's so many different ways that employers can do this: training, peer support programs, and through us providing consultation around designing work life itself to promote psychological health and safety. So that is the long-winded version of who I am and why this work is relevant to me at
Right,
all.
right, absolutely. That's so important. That's so important. Something I have a question that I asked you before, and I'll ask you again because I want to see if your thoughts have evolved or whether or not they're similar to where they were before. So, what does psychological health and safety mean to you?
Oh, I'm so curious about what I said before. You'll have to tell me how my answers compare. I'm starting from a clean slate. Um, Today, I would tell you psychological health and safety means designing work in a way that enables people to thrive. So it enables people to do their best work with the least risk of harm and the greatest potential for mental health enhancement. We often forget that work isn't just a potential source of stress. Work can be enhancing to people's mental health, and ideally it should be. And so when jobs offer meaning and control and flexibility and purpose, they can actually strengthen mental well-being. But when those factors are off, they become hazards. And so I think of psychological health and safety as tipping the scales, amplifying the good and minimizing the harm.
Right. I again, I didn't. I may go back and listen to it, but I like that definition, and I like that idea of tipping the scales. I think sometimes when we have conversations about psychological safety, bring my whole self, all those kinds of workplace mental health, people seem to believe it's airy fairy. Everything's got to be perfect all the time, and that's not the case. It is simply saying that you will be exposed to potential hazards at work. It doesn't mean that they have to kill you. It doesn't mean they have to. It doesn't mean you won't get exposed because there is no, as I say this often, there is no environment that is 100% psychosocial hazard free. It just isn't. It's not possible because of the very definition of this kind of hazard. There's no way that they aren't there ever, but they can be less harmful. And they can be, again, I share this often. I spent time going into buildings on fire, something that literally can kill you. I never got physically hurt because I knew what I was doing. I had the skills, I had the equipment, I had a support system. So it's not that the hazard's not there. It doesn't have to harm you. And if it does harm you, the harm can be very minimal by all kinds of other approaches. So I have to think about that idea of just balancing the scales and not saying, oh, the world's going to be perfect and everything's going to be great every day, because some days it won't. But on those days, will it really take me out? And it shouldn't have to.
Exactly, perfectly said. And this is probably the number one misconception that I'm needing to clarify. We're not saying, because sometimes people will take it to an even greater extreme, and they'll say, oh, this is unrealistic work that's trying to eliminate workplace stress. We wouldn't do that even if we could, even if it was possible. Stress is a performance enhancer. The right amount of stress can help people stay motivated, help them perform better in their tasks. It's not about eliminating stress. To your point, it's about reducing the risk that it becomes hazardous, that it really injures and harms people. And employers should have a vested interest in that, because if someone is injured or harmed, they're not going to be productive. They're not going to last in that role, last with that company. And they're at greater risk of things that are going to cost the employer money, like uh, disability leave claims, or greater cost of healthcare utilization. So this is really about, yeah, calibrating the amount of stress to a level that is reasonable and takes into account the fact that um, anything more might put someone at risk of harm that not only causes individual impact, it causes organizational and bottom line impact too.
Yeah, and I want to mention this one other thing that you said earlier that really kind of, caught my ear. You talked about the importance of workplace transformation, and interestingly, if you look at the way, so our here in the United States, our current workplace setup was not set up to be healthy for human beings. It wasn't. It was generally set up to exploit the human being. It just was. And I'm not suggesting that in every case it was even intentional, but it was so much of a focus on we've got to get the work done, the job done, the cost to the humans was like, that's part of the price we have to pay. But I think we are more sophisticated as a society now. We have more information at our disposal. We have more resources and systems to protect people than we once did. So just kind of casting it off as that's not, it doesn't have to be that way. And we weren't okay. So in 1970, when the Occupational Safety and Health Act was passed, 14,000 people a year got killed at work. We wouldn't say that was acceptable now. There's still about 5,000. We think that's too high. But no one, I can't think of anyone go, that's just the way it is. Times have changed. We need to have the same conversation about the stress that human beings are being exposed to right now. We could have that same kind of increase, that same kind of better environment if we first acknowledge it's a thing at all, and then we did something about it.
Yeah, exactly. And I think that is what has been encouraging to me over the past few years. When I explain the concept of psychological health and safety, I can see light bulbs going off. It's an intuitive case that we make for the value of psychological health and safety. It is reasonable when you put the pieces together to expect that when we can prevent harm from happening in the workplace, we should. And if we can do that around mental health, that saves employers money in the form of investing in prevention versus treatment of conditions that they might have contributed to through working conditions, and that it's the right thing to do by employees. The real question I think that comes up after that aha moment is, but how? Like, feasibly, how can we do this? And that's where there has been this good news to share, that there's frameworks, there are resources and tools that make it possible to do this work in a way that maybe doesn't have to sound as ambitious as a workforce transformation, but is really something that you integrate into ways of working. Doesn't have to cost a lot of money, doesn't have to be excessively resource intensive. We have tools and resources and frameworks that can guide employers on how to do this, and to do it in a way that is reasonable, feasible, and still has the intended impact.
So you and the guests from the episode just prior to this one have never met, have never talked, but you both use that same word about transformation. And my guest in the previous episode, Simone Bowe, she's a consultant. She talked about the importance of transformation starting with the person. Because you're not going to get transformation in the organization if the person, the senior, particularly the senior leaders, don't believe in it. You won't, because you won't. It sounds good. It's not for just everybody else. It's for me and everyone else. It's an and thing, not an or thing. And I just really, wow, it's just an interesting, almost coincidence, but one that I think is important to talk. Transformation is possible. It can be done. It starts with you, but there are tools out there to help you. You don't have to do it all by yourself. And so, with that thought, if you were speaking to a group or speaking to the world in general and had to give your assessment of where psychological health and safety is in the U.S., what would you say? What would you say?
I would be honest, and I would say we are still in the early days when it comes to psychological health and safety in the US, unlike in Europe or Australasia, for example. There's no regulation here that's compelling employers to adopt psychological health and safety. Most US companies aren't yet seeing this as an essential part of their business strategy, and I honestly believe that's because, in large part, there's a lack of awareness. So there's low adoption, but there's also low awareness. I think that's improving. We see it at Lyra. We're a workforce mental health company. So we are providing care benefits as our core offering, but we also provide workforce transformation services. We provide other services that are more in the preventative side of things. And so the fact that an employer is investing in workforce mental health is often a good sign that they might be motivated to do more. And we really try to work with our customers in a consultative way. And when we consult with them, what we learn is they're facing issues like burnout, turnover, mental health related disability leave, and they're not often thinking about systemic solutions or in the workplace solutions. So when we can talk with them about ways in which they actually can exert more control than they might think, we see interest. We see willingness to consider a broader array of support options than just sending people to go get care. And so I would say there is this minority of forward-thinking employers who are starting to trace these costly outcomes to the business back to modifiable work conditions. I'd say in the US as a whole, even when there is awareness, HR often doesn't see it as their role. Occupational health teams don't see it as their role either. It falls in the cracks. And so a big part of our work in supporting employers who do have interest here is actually kind of helping them set up the infrastructure within their organization to be able to do this work and bridge some of the gaps that often exist between disciplines like HR and occupational health.
Yes. Yeah. Again, I guess I would be surprised if I heard you say anything other than what you said, because it's realistic. Yeah, it's a very realistic approach that, again, gets back to that conversation about balance. We are, a decade and a half behind Canada and Australia and, parts of the UK. But that doesn't mean that we can't, because of, and what I heard you say is that there are those forward-thinking employers already. They are looking for a competitive advantage. They are looking for, how do I recruit and retain the best talent, not just average talent, but the best talent. And what I find is, so there's a statistic out there or a data point out there that suggests that turnover in U.S. companies cost our economy $1 trillion a year. And that's a lot of money that could be spent on all kinds of things. And on top of that, you have a generation of digital natives that are coming into the workforce on the heels of pandemics and all kinds of other things with a different kind of approach to work in general. And some, my generation ish, would call them, you're weak and this is what I had to do. And well, no, what I say is no, they're just a little smarter than you are. They they do. They saw your example of how it affected you, and they don't want that to happen to them. They don't want to fall in that same hole. They don't want to have that problem. So they're just approaching work a little bit differently. And so I think all the stars have really aligned to get exactly what you talked about, that there are going to be some, they're going to get it early. They may not be totally sure how to do it, but they know what they're doing now is not getting them what they want. It's like building a sports team. I'm a professional football fan, and you can't build a football team with just a great quarterback or just a great running back or in baseball, just power hitters. You have to have the entire team if you're going to win the game. And a lot of these companies, they've got the supply chain part down. They've got how they've got great, boards and all. But in this area, they sometimes just don't know how to do it. And that's why they need folks like Dr. Joe to come talk with them and to help them out.
Yeah, and I think you are spot on that there are these generational differences, there are organizational differences, industry differences, but I think on the whole, this generational shift is really important because that's cross-cutting. I think we are seeing that stigma about mental health is way down across the board for Gen Alpha, Gen Z, compared to older generations. And now what employers are saying to us even is that mental health benefits feel like table stakes. And so it's much more of an expectation now than it was even 5 years ago that you're going to be providing robust mental health benefits as an employer that wants to attract and retain a younger generation of employees. So now that really is leading employers to look around and say, like, well, what next? And I think it's also being pushed by those younger generations who are saying, yeah, I appreciate these mental health benefits, but I also want to work in a workplace that doesn't force me to use those benefits because of working conditions. And so there is this kind of grassroots pressure that is compelling employers to pay more attention to this. And to your point, it does become really important for things like retention or talent recruitment, because what you're speaking to if you're doing psychological health and safety work, psychosocial risk management, what you're speaking to is a tangible example of how you show that you care for your employees that goes beyond benefits. And that is an advantage. And the employers that do this work are demonstrating in a really visible, concrete way there's real commitment to caring for the workforce.
Yeah, it's kind of an exciting time. I rather enjoy new kind of pioneering. I'm a Star Trek kid. Seriously, I was I think I was headed to kindergarten when they first debuted. So that's, so when you looked at the bridge of the Enterprise and all these people from all over and Gene Roddenberry, I'm told, was a bit of a futurist. So I won't get off into conversation about Star Trek. But anyway, I enjoy the idea of us doing something new, something that we haven't really done before. Not all the data is there, but there's enough to suggest that let's go out there and explore that. And I think we have an advantage in the United States in that Canada and Australia and some of these other countries have done a lot of the hard work already. They've created the standards, they've drafted the laws, they've practiced some of this. So I don't think that our progress has to take as long as theirs did, because we're not necessarily pioneering here. So I think we have a real opportunity to use, some of the other strengths that we have as a country to move a little quicker and to, and I get it. I get it that some people, it's all about the dollars and cents. I get it. It's not for me, but it is for some people. And I acknowledge that. But this is a pretty dollars and cents thing. I haven't found it. So there's a difference between a business and an employer. About 5 million businesses get formed every year. About a third of them actually become employers. And that's where a lot of them go sideways. Because they were really good businesses, they just aren't great employers because they don't know how. They know about the business. They don't know about people. Some of them don't even like people all that much. They just kind of need them around to get stuff done. But if you're going to be successful on a grand scale and you can't automate everything, I think we'll get there. We'll get there someday where human beings will be taking very few physical risks. But we're always going to have psychosocial risk, I believe.
Yes, 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 totally agree. And yeah, what you were describing as the difference between a business and employer, and how when a business becomes an employer, that doesn't automatically mean that they know how or are even motivated to care about what falls in the psychological health and safety realm. It reminds me of managers and direct reports. Just because you've been promoted into a management role does not mean that you know how to be an effective people leader and manager. And so there are a lot of things that we take for granted when it comes to the like there being an innate ability or knowledge to manage people, motivate people, keep people engaged in a way that is going to generate the productivity and the revenue that businesses and managers want. Just because you're in the role to employ someone or you're in the role to manage someone does not mean that you innately have these skills. And so that's what I love about psychological health and safety. It's recognizing that and it's saying, here's a system and a structure for doing things that might sound intuitive, but are not. And if you can do them in this systematic way, you can prevent yourself from trying to figure it out on your own or putting this expectation on yourself that it should just be innate.
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the FlourishDX Academy. www.45003.org. Now back to this episode.
I took golf lessons about 25 or so years ago. I don't play all that often, but someone told me, they said, if you're going to go out and play, take lessons so at least you don't start off with bad habits that you have to break. And I find that with a lot. I became a supervisor at 27 years old. I'd never supervised anybody in my life. I didn't go to any classes at all because at the time, my employer at the time basically said I was too young. So I was old enough to get promoted, but too young to get into the class. So they just tossed me out there to figure it out. And as I started to observe, I wasn't the only one. As a matter of fact, I found most people that were that way. They got the promotion, got hired as a supervisor, as a people leader, as a whatever, but the skill necessary, the knowledge, skill, and ability necessary to be effective in that area, I just never got it. I'm a mathematician, a banker, a chemist, whatever. I'm good at the tangible physical stuff, but the emotional stuff, this other human being, and it tends to be the toughest part of the role is to work with other people and to share ideas with other people. Because if we can get that part down, all the other stuff is really pretty easy. It really is.
100%. 100%. Yeah. Humans are way more complicated than any system or protocol or process you're ever going to encounter. There's way too many variables to give someone a simple manual and expect that they're going to be able to figure that out. It's a skill, it's a set of skills, and it's also the skill of knowing how to apply the right skill at the right time for the right person. Yeah.
Yeah. And again, for the right person, again, these gems that you're dropping here, for the right person is also, I think, essential because, and I share this often, the difference between the scientific management approach that says, Robert Taylor says, everybody's got to have a number and they've got to be managed and it's got to be efficient. But Mary Parker Foley said that, yeah, we actually need to create an environment where these human beings will do great things together. And they both have value, but we've done more of one than the other. We focused on these systems to be able to have people show up at 8 o'clock and punch the clock. And we have managed human beings like they were commodities, as opposed to realizing that they are not only human beings, but they are individual human beings who have very different approaches. And so the definition of psychosocial hazard that I use in my research and in my book is psychosocial hazard is dependent on the person. It's the perception or experience of the person. So I feel it's threatening to me. I feel it's a potential hazard to me. No one else in the room may feel that way, but it's real to me. And then I start to behave based on how I see the environment. And, you talked earlier about sometimes people look at this psych health and safety thing and they think that I could never do that. You actually can, and sometimes it is much simpler than it seems.
100%. I used this example recently at a conference. We worked with a customer who was struggling with role clarity as a psychosocial risk. And you think about something like lack of role clarity, it sounds benign. What does it really mean? If someone has poor role clarity, they could end up working on tasks, activities that are not high value to the business, not of importance or priority to the manager. So you have a frustrated manager who's seeing an employee working on things that are not high impact. You have an employee who's frustrated that their work isn't getting recognized, not knowing it's not the right work to be focused on. And often they're working on work that's someone else's job, that's someone else's responsibility. So they're stepping on someone else's toes and creating psychosocial risk for that person. So the exercise cost nothing. It was, let's have the individual contributor write their own job description based on what they think their responsibilities entail. Let's have the manager do the same. They compare and they reconcile the misalignment. Cost nothing, didn't take much time, and yet was extremely effective. And there are so many examples of inefficient, ineffective ways of working like that can be remedied through something that is simple, easy to implement, doesn't require big structural change. And that work is only, the work is compelled by something like a psychosocial risk assessment or just talking with employees. And that's really just the missing piece. If you're consulting with employees on how different aspects of work are affecting them, that's where you're going to learn there's all this low-hanging fruit that you can address. But unless you're doing that basic foundational thing, you're going to miss it. And there's going to be all of this work that's happening that is inefficient, ineffective, causing unknown harm, and ultimately costing the business money to bring it back to dollars and cents.
Yes. Yeah. And so again, that example is so important because it is fairly simple, easily addressed. But if you don't address it, it leads to other things. So I'm unclear about my own work. You're unclear about it as well. So my evaluation is always a little bit off because I think I'm doing the work or I want to be recognized, but I'm not. But I thought this was my job. And when I got hired because I had skills in this area, which is why I spend time in this. And so there's all this stuff going on in my head. We have conflict about it. Let me take it to its really crazy, conclusion. We have this conflict about it. And then it's, well, it must be because I'm X or because he or she doesn't like me and they don't. And there's all this stuff going on in my life. And before we know it, we're in this altercation and that could have been resolved by simply a clear expectation of the role. And I, because my graduate is in HR, and I am absolutely opposed to job descriptions that say other duties as assigned later. That's a problem. Not other. If you don't even know what it is, what do you put that in a job description for? Because then the manager feels like, well, I can just give them this. They're not qualified for that. They don't know how to do that. They may not. They may not want to tell you that because that starts to affect me. I'm a pretty intelligent person, and they gave me this, so I'm not going to tell them I really don't know how. So I'm going to. You see, there's all this confusion, but it's not about the two people. It's about the system we've put people in that had these kind of unrealistic, didn't have the controls where it needed it, and had unrealistic expectations in others that can be fixed so easily. They're not hard.
This has happened to me before. I'm speaking from personal and professional experience. Yes, I've experienced exactly what you're talking about. And again, it's often it's often done without awareness on both sides. And so that's what I really appreciate about investment in psychosocial health and psychological health and safety. It forces intentionality. It forces us to evaluate what's happening that we take for granted, we don't pay attention to, we don't acknowledge, and is that stuff working for us or not? And if it's not, here's our opportunity to make it work for the business and for the employees.
Yes, yes, yeah. As if you look at businesses that have been, again, businesses that have been in business for the last 80 or 100 years. So you started in 1920 and you're in business in 2025. The world is simply different 105 years later. It just is. It's not that that world was better or worse than this one. That's not the point. It is just very different. Everything is different. The way we see all kinds of things is different. But your system was built then. It was built to really work for that group of people. And this is where I really struggle with these, organizations who are just so much about, our traditions. And your traditions are great as long as they work for the current people. When they don't work for the current people, that's a problem because that's how you end up out of business. Because you're still serving, the founders said we were going to do this thing. The founders are dead. they are. I struggle some days when people talk about the founders of the country, and the founders of this country thought that I was 3/5 of a person and wanted to own me. So I struggle a little bit with not everything that they said was good or bad, but things have changed. We need solutions for today's challenges and for the challenges in the future, not simply redoing the same thing over. And none of us like it. None of us really enjoy it. None of us are really doing our best. But that's how the company was started, back in 1963 when so-and-so, him and his buddy started this thing. And how much more freeing is it when we go like, let's do something that's going to help us, not just me, us be successful today and into the future, as opposed to continuing to pay homage to the past.
Perfectly said. Yes, yes, yes. And I think people default to tradition or the way it's always been. Sometimes it's out of reverence. Sometimes it's out of ease. It's like, well, I don't want to disrupt the status quo. So not only is it ease, maybe sometimes it's lack of psychological safety. It's fear of what would happen. My reputation's on the line. If I'm going to put it out there that something doesn't work, that the founders intended to endure, maybe didn't even intend to endure. It's just always been that way. So maybe I don't want to touch it because it doesn't feel safe to touch it, or because I don't want to be saddled with the responsibility of having to do something about it. And so let's just keep the status quo in place unless someone wants to speak up and volunteer, but that's not going to be me. And if everyone feels that way, well, then that's how you get systems that don't work anymore, but continue to operate as they always have.
Yes, yes. So tell me a little bit about, think about two or three of the, or whatever number you like, of the organizations you've worked with or working with now that do get it? What are some of the things that they're doing that are different than the kind of the status quo? What brings them to the table, and what are some of the things that actually get them to actually do something different?
I think it starts with the fact that they have listened to their employees in some way. They paid attention to the engagement survey. They're looking at attrition data on certain teams. They're reading the exit interviews, or they're looking at their care data, and they're seeing the percentage of people coming to Lyra seeking care because of a work-related issue. And because they paid attention to that, they are curious and they're wanting to learn more about what they can do further upstream. And I think what makes them different is this willingness to think about supporting employees based on what's going to fix the problem, not just what is easiest to deploy. Because it would be very easy for an employer to say, well, let's just run another training and train people on better coping skills. There's a lot of employers that'll take that approach. The ones who are doing psych health and safety are saying, now that we've listened to people and we understand their problem, we're curious about what actually is most effective to fix that problem at the source. And that, I think, is what differentiates them from everyone else.
Mm-hmm. That's I do have to say, and again, it was one of the reasons why I wanted to speak with you. It's encouraging. It's just it's encouraging that people are starting to get it, and they are looking at the data. It's not simply those of us who think it's a cool thing to do. I don't have all the data. I have just enough, it's happened to me. People are actually starting to go, wow, there's actually data out there. There's facts out there to back up that this can be better. And we're starting to find examples of companies talking to each other and talking to folks like Lyra that say, is there a better way? Well, yeah. I mean, you actually can do this better than the way that you're doing it right now. And it's just really, really encouraging, and so again, you'll be again one of the speakers in Australia again a few weeks from when this episode debuts. What are you looking forward to when you get a chance to talk to our friends in Australia?
Oh gosh, I am looking forward to being my authentic nerd self. I'm going to spend as much time as possible picking the brains of some of my favorite experts in the field. A lot of the other experts who are attending are folks whose work I admire, I follow, I read closely. So I'm going to be attending every session. I'm going to be looking for every opportunity to strike up conversation with them. I think there's a lot for me to learn. And my favorite thing to do when I attend any conference is to bring back all of my learnings to my team and use it as inspiration for how we can grow in our capabilities and how we serve customers by learning what best practice truly looks like, and frankly, in places that are more mature or advanced in certain areas than we are. So I'm gonna just completely nerd out and do it with abandon. And I so appreciate this venue being created for us to do just that, because I imagine you're probably have some of the same goals that I do that way.
Yeah, I don't know if you can feel it through the camera, but the spinning. I don't have like real hair, but my metaphorical propeller is just turning. I agree with you. I have a very similar, kind of interest. It's not just the opportunity to share whatever bits and pieces I can share. It is there are still just a handful of venues where people who are interested in this topic can get together and just share with each other. This will be, our first opportunity to actually physically be in the same space. And that's happening more. I'm running into people, having the opportunity to meet people I've known for 2, 3, 4, 5 years, but have never really met in person because of our geographical distance. And on the psych health and safety side, I'm meeting my U.S. colleagues often in other countries because there aren't as many venues here because we're still kind of the secret society sometimes.
Yeah.
I mean, seriously.
That's a good description. Yeah.
So sometimes, the psych health and there's like three of us over here in the corner, but everything starts that way. It starts that way. It has to start someplace. And it's good to know, like I said, that there are more than just, I consider myself to be, an occupational safety and health professional, but I'm kind of an activist around this idea. And I think people ought to do it regardless. I don't, sometimes I'm not bringing, I have some data, but I'm more of a, I'm more interested in qualitative data anyway. And, another thing that you mentioned, people, Dr. Myron Golden suggests, and I repeat him a lot, that people do things for one reason and one reason only, because they feel like it. And if they don't feel like it, there's not another 15-page study or another longitudinal study of such and such a group that's going to change how I feel about that thing. And the way to get me to change how I feel often is simply to ask how I feel to begin with. How does this work for you? Just really, not a bunch of how does this work for you or not. And often folks will just simply share, either it works or it doesn't. And if it doesn't, they'll probably tell you why. And then the question is, what do you do with that data? Because if you do something with the data, they'll give you more. If you do nothing with the data, they'll give you less.
100% right. And if you don't do anything with the data, you're eroding trust. And the minute you do something with the data that they can see, that they contributed to, you've built trust. And fewer things are more predictive of someone sticking with their employer than feeling like they can trust their employer.
Absolutely. Absolutely. So as we begin to wrap the conversation, share a little bit about, what it's like, a little bit more detail about some of the things that Lyra does, because Lyra is still fairly new. It's not like you've been around, a legacy company's been around for the last 50 years. So share a little bit about, the suite of things that you all actually do.
Sure. So we just celebrated our 10-year anniversary, and we are always thinking about how to innovate further. But to date, our bread and butter has been providing access to high quality mental health care that supports the full spectrum of needs. So that means preventative solutions like what we do on workforce transformation, like our self-care suite that's focused on promoting coping skills and effective evidence-based techniques I can use for myself to help myself thrive. Then we have coaching to help you with issues that might be milder. Maybe that's improving your communication skills, it's improving your setting and achieving of personal goals, or even mild depression. Then we have therapy for those clinical conditions like a depression, anxiety, a PTSD, insomnia. And that within that, we have the full range by age span. So for children, for teens, for adults, we have different clinical programs for different conditions. And then beyond therapy, we have medication management. And then we also are providing a kind of consultative support on how best to promote all of these services, engage employees in them, and make sure that people are using the services that will benefit them most. So I think the whole impetus of Lyra is still relevant, which is if you need mental health care, you're on your own, and you're going to face difficulty finding the right resource, finding the right provider, knowing that that provider, if you need one, is of high quality and is well suited to your needs. And Lyra solves for that by having both a highly curated, highly vetted network of providers and also an intake process that guides you to the right resource, so you don't have to wonder and figure it out through trial and error. We're going to guide you to the right support for your need.
Wow. Again, just encouraging, because as I think back, particularly over my early work life, it would have been really nice to have had something like Lyra around. to be quite honest. Because again, as I share, I don't recall ever being physically injured at work. I seriously don't. So I didn't have to go. I wasn't never treated to transport to the hospital. Didn't have any of that physical stuff. But the psychological stuff, oh my Jesus! And it started all the way back when I was 11 and got robbed. Got robbed delivering newspapers. I didn't physically get hurt, but emotionally, that's trauma. And again, as I again have more birthdays, I'm not alone in that. There's a lot of people that physically they look fine. They look physically healthy, but emotionally behind that, there's just some struggles that they have. And because of you said that the stigma is certainly changing with younger generations. With a lot older, there's a lot of stigma associated with even asking for help, with even, and thank God for therapy.
Yes, glad to hear you say that. Yes,
absolutely. Yeah. There are some things, and I really honestly believe that in many cases there's a course of therapy that can resolve that thing, at least in your mind. You don't have to, there'll be other things, but that particular thing, it's possible. Just like you can be cured from some physical things, I think you can be cured from some psychological things as well. They don't have to burden you your entire life. I have seen all kinds of things, but I'm not having night terrors and can't drive and any of that kind of stuff. And a lot of it I attribute to the time I spent with a therapist.
Yes, and we need more people like you to share stories like that, because that plus mental health literacy programming is really what motivates people to reach out for the support that they need, that they might not have even realized that they needed, or might not have believed would be effective for them. So that's why I love mental health literacy work, because you can't just take it for granted that because resources are there, people will use them. You need to first teach them to recognize the need for those resources in themselves and convince them that those resources are going to work for them.
Yes. Joe, thanks so much for spending a little bit of time again. I am certainly looking forward to hanging out with you and others when we get a chance to get to Australia, and I'm probably going to have to find an opportunity to get out to where you are anyway. But again, thank you so much for sharing your expertise, and often I end up talking with folks who kind of get it, emotionally, but don't really have the technical expertise like a guy like you have. So it's nice to get a real expert every now and then.
That I can't think of a higher compliment coming from an expert. And,
Yes.
and by the way, congratulations on your book. I'm very excited to read it.
Thank you. Thank you so much. Thank you so much. So that's just a wonderful conversation. I leave feeling better than I felt when we got started. So if you're watching or listening to this podcast for the first time, welcome. I hope something that you've heard will bring you back to a future episode. Previous episodes of this podcast can be found at psychhealthandsafetyusa.com. You can watch, like, subscribe, and share the podcast on the Flourish DX YouTube page. And you can join the Psych Health and Safety USA movement by connecting and becoming a subscriber on LinkedIn. So until next time, stay tuned and look out for the next episode of the Psych Health and Safety USA podcast. Tune in each week for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to david@id2-solutions.com or go to the Flourish DX website at flourishdx.com. We'll see you next time.